everybody? Arthur Mondale with WPTV News Channel 5. How you feeling right now? How is COVID impacting your life? How's COVID impacting your family's lives? How is it impacting your job? Do you still have your job? COVID-19 is impacting a lot of people, and there's a lot of data that's going out right now. I'm a television reporter, so of course I do my research. And so I have this data from the CDC, and it says symptoms of COVID-19 related trauma and stress-related disorder, increased substance use and suicidal ideation were more prevalent among those employed than unemployed respondents and among essential workers than non-essential workers. So it's clearly there's a problem. Recognizing the problem are those on the front lines of moving people forward. Hey, Joy. Joy is a real joy, everybody. Joi Honer, yes, Retreat Behavioral Health, Senior Director of Alumni and Community Engagement. There's a big thing happening. Now, if you're watching WPTV News 5, I did a whole pack. I spent the whole day at Retreat, actually. It was really good to spend time with Benjamin Champion. Benjamin Champion, back in May 2016, he found himself on the other end of the line. Right now, Champion is one of the regional outpatient coordinators. So basically, if you've gone through, if you're relapsed, if you're searching for outpatient community services, you call him. It's just interesting. Rewind back, 4 years, and someone was taking his call. And so he suffered from alcohol use. So he definitely understands how people would actually turn to something of this sort. But then he brought up another layer of this, being a man from, has a Hispanic background. And so it was interesting. If you watch that story, you can go to WPTV.com, you can pull it up. He says, being a man that drinks, not being able to hold your liquor was seen as a bad thing. But there are those on the other side, including him now. Because he works at Retreat now. And if you have a problem, he wants you to seek help because help is actually out there. And that's why I brought Joy, who's a real joy, here today. Tomorrow, they're going to be doing their seminar called Winter Wellness, The Gifts of Recovery. They're going to have a whole panel. This is coming out of Pennsylvania, correct? Or do we have panelists from Florida? Joy, you can talk. Go ahead. Yeah.
Oh, well, we have most of our panelists this time are from Pennsylvania. When we have panels like this, I do try to move the panels around, so to speak. We just happen to have a lot of Pennsylvanians this time.
Absolutely.
But we have a fantastic lineup. We have folks in recovery. We have from the community. We have somebody who's a peer recovery support specialist and also a person in long-term recovery. We have an alumni, Grace, who is also part of our team now. And we have one of our clinical folks. So one of our clinical experts that will also talk from that professional perspective, who's actively working with our clients right now in treatment.
Absolutely. Okay. So I want to rewind first. I understand that I spent the whole day at Retreat and I was following, what the team does there, but you actually have to be willing to seek treatment in order for the team that's willing to help you to do their job. I got some data, and I brought it up actually in my package earlier. Numbers, if we look at racial breakdown, because that's kind of my specialty, that's my beat, that and jobs. The National Alliance on Mental Health reports almost 50% of white adults seek help versus only 25% of Asian adults. And then you have Black adults, it's 32%. And that breakdown, okay. So one of the things that I have brought up to my team, because we do morning meetings every morning before we go out to the field and get the nuggets. Does this mean that the groups that aren't seeking help are more resilient? And your team at Retreat quickly shut that down. That is not Joy. What does this minorities less likely to seek treatment? Asian, I couldn't believe it. Asian adults, 25%. So I heard two things. It was, there's a cultural thing here, but also treatment isn't seen the same way across the board. Can you go into?
Well, so we've acknowledged and we've talked about, we are well aware that there are inequities, for instance, around institutionalism and racism, that people of color have historically experienced less opportunity to access treatment when they are when it's related to incarceration. That that historically, folks who are white have been more often given the opportunity for treatment versus incarceration. Folks, people of color have not necessarily been represented with the appropriate legal support. Also, for instance, and that's one issue for sure. So somebody
Okay.
who winds up being involved in the criminal justice system as it relates to substance use disorder or mental health, they might not be given the same opportunities of someone who is white. And again, we're aware of that. But another piece of that you talked about was culture. Some cultures, for instance, Asian culture, there might be that stigma around asking for help. We help each other. It stays in the family.
Yep.
Don't, so, and that could be, there are many there are many groups of culture within the Black and Latino community. You have different Latinx communities.
Yes, you do. We're not a monolith.
So you might have one culture.
Yeah, that's a good point.
To ask for help, and you might have another culture where you don't tell anybody anything. You keep the family. You keep what's here in the family. We'll help you. You don't talk about, or you don't get treatment because you're telling on us.
Yeah, so I want to give these groups those resources in a minute, but then I also want to go to something else.
Sure.
Another thing that Joy and the staff at Retreat taught me was I went in there and I said, "What about, how do you know you don't just have the winter blues? And that's why you're drinking more or you're smoking more cigarettes." You all don't like that term. I don't know if it's not a real term because people use it. It sounds cute. It sounds cool. I have the winter blues. That's why I'm in this mood.
Well, and I think that it's okay to use that in a sense that people are more comfortable saying that. I get that it's so to me, and this is, I think, something that I was recently talking to somebody about was, I don't care what you call it. If you want to call it depression, if you want to call it sadness, if you want to call it what is the disorder related to light and the lack of exposure to the sun, seasonal affective disorder, or the winter blues, the point is what are you going to do about it? Because very often in the case of depression, what we know is it's a biological and psychological circumstances. And so lifting yourself out of it may not always be the answer. And that's the challenge with COVID and social isolation is, how do you reach out to those resources if you're experiencing some sadness now? I know we talked about that people who were recently polled, 31% of folks identified that they've experienced within the past 4 or 5 months increased anxiety and depression. And increased, again, as you said, the trauma response disorders, those maybe PTSD, increased use in substances, all of those things. Some of them may be resolved by doing different behaviors, and we'll talk about those things. How do we help ourselves in this pandemic? At the same time, some things really need more than just, I'm going to pull myself up by the bootstraps, and think my way out.
Okay, yes, that's a good point, Joy. Because the name of the seminar tomorrow at 7 p.m. on Facebook, Facebook Live, which he's hosting this, it's called Winter Wellness: The Gifts of Recovery. And one of the things here was you're about solutions. When I was giving you and your team the data, the numbers, the stats, it was more like, okay, you have a choice whether or not you want help, and you have a choice of determining how quick you get. Go into that, because you said there are support Zooms. Go into all that, Joy.
Well, one of the first things one of the reasons we chose the term winter wellness and the gifts of recovery is I want to focus on what the solutions are. You can get out there anywhere and see the reports like statistics like this, see the reports that people are struggling, and we've already decided that. We've already identified that. So what can we do to get well? What can we do to support lifting ourselves out of this kind of COVID funk that we're in? And quite frankly, as a person in long-term recovery, I'm in recovery myself. What I've learned is a lot of the coping skills, coping mechanisms, support systems, attitudes, behaviors, and actions that I've acquired in recovery that sustain my recovery have also allowed me, and I've seen allow others sustain their recovery and manage some of these challenges in a way that maybe
Yeah.
wouldn't know about. I mean, I think
Yes.
about, that's the gifts of that. And that could be somebody who's gone through mental health, anybody who's used resources beyond themselves to reach to that next level of health or wellness or mental or peace or recovery. All of that, we have those resources. We practice them in other ways. Now we just kind of have to apply it to a different situation.
Empowerment is a strong message in wellness. That was my takeaway before I left the doors. Yes. Okay.
It's interesting because, a lot of what folks talk about in recovery is the word powerless. And that is something that's kind of a commonly used term in regards to that initial acceptance is I can't control this.
Oh.
But the good thing is we can control everything else.
Yes.
We can control all those.
Absolutely.
Pieces.
Oh.
We lose the substance itself. So once we're free of that, I can choose how I act and react at any time through resources, friends, support, internal resources, coping skills, action. Like, you and we've talked about, and I know the folks at Retreat talked about some of those solution-based behaviors.
Listen to that. Solution-based, and that's the thing. Because you all aren't giving up on the general public. You see this, but you say, folks, there are solutions out here. And let me tell you, they go so far, because I actually want to take your questions. I'm asking all of our viewers who are watching this, please please type in a question, because I will read it. Joy, the expert, will answer it. If you have a question for me, I'll give it to you. I like sharing my opinion as the most talkative person here. Okay, so one of the things that you said, Joy, was get active. She listed them. Okay, because these are gifts. These are called, and this is the first time, Retreat has been here for decades. This is the first time they've ever done a seminar like this. First time. Holiday gifts, focused solutions seminar. That's why I really think people should join tomorrow at 7 p.m.
Well, you and I talked about one of the important things is this is not for just people with mental health issues.
Yep.
Or people in recovery or people with substance use disorders. There are so many things that day to day that again, those gifts that recovery have given us that that the normal day-to-day person, somebody who might not have been part of a mental health system or had to look at some of their somebody who didn't engage necessarily in professional help or need to, a lot of these you can utilize just like we're utilizing them.
Absolutely.
And you may not be aware of those things. And, I have a list of things that we're going to discuss as a whole, and I'm happy to go over some of them.
Please.
All right. So one of the things that we know that's important in getting well from the impact of mental health or substance abuse issues is developing routines. And I think during COVID, as we get in our jammies and kind of stay in them all day, or maybe, we're out of the normal routines that we have, building routines at home while we're in isolation often can help us get a sense of mastery and therefore give us a sense of control. Maybe not control over everything, but if I get up and I get a shower and I get my breakfast and I do a meditation and I read a little bit, if I create some routines, that often is helpful as a coping mechanism, because again, it makes me feel like I have some choice and I have some control of my environment.
Create routines. Next. Good.
Virtual connections. So, I know that we're kind of zoomed out, but guess what? That's what we got. So FaceTime, phone calls, I know some friends that created a book club, a new book club.
Oh,
And
okay.
so, they use that as a reason every, Thursday night to get together and just talk about a book they're reading. And for people with mental health or substance use disorder issues, there are many free online mutual support groups like 12-step fellowships, NAMI groups, smart recovery. There's a lot of Al-Anon, Nar-Anon. There's a lot of organizations now that have. I kind of joke, but it's actually true because of time zones and stuff. You literally could join a recovery support meeting 24 hours a day right now. And the good thing is, so what if you've never attended them?
Mm-hmm.
The cool thing is you would be completely anonymous. So you can check out someplace that you might have hesitated to utilize. Say if you have some adult child of alcoholic, kind of situations, and you might find that Al-Anon or ACOA meetings might be helpful. You can check them out right now online, and nobody's going to know. Yeah. So because
I never thought of that. Never thought of that.
Your neighbor. You're not gonna, you don't have to put your screen on. You could just join by Zoom and keep the camera off. You could make up a fictitious name at the corner of your box.
Yes.
And you could be so not only do you have the ability to connect to support groups, you could really be totally anonymous.
Anonymous. I like that. And then get outside. That's the next one, right?
So yes, get outside. So we know that COVID has kind of kept us in our little cocoons. The act of just a simple walk and a daily simple walk, allow the sunshine to hit you, connect with the earth. And again, because of COVID, I am challenged to direct you to invite somebody else because I really think at this point we really need to be safe given the circumstances. But enjoy some music or a book on tape and bring it with you, or your dog. I mean,
Yes.
Dog is always. But get moving,
moving.
And that's the second piece of this. So a lot of us, for many of us, exercise has been a really healthy coping mechanism. And I actually teach Zumba fitness at my local YMCA. And
you do it all.
I know, right? Why not?
Yes. I'll go.
But our gym closed, and I support that. I support for the safety of our participants.
Nice.
We're going to close for we closed throughout the holidays. Because of that, the uptake in cases, we wanted to make sure that folks were safe.
Okay.
And so, but that's no excuse. So there are lots of virtual fitness classes. If you go to, for instance, your cable company, most likely they will also have channels that have fitness classes, that daily walking. Being physical is an important coping skill. It's very healthy. So I talk about what's the word? Being external while we're internal. It's also helpful to be internal while we're internal. And there are a couple things that you can do to take this time, which may not happen. So for instance, somebody who's a workaholic, somebody who goes and goes and goes and goes, maybe this is the time where you slow down, where you meditate, where you journal, where you those kinds of things might be a resource where you can do some internal introspection that might help you create some changes.
Internal, I'm a firm believer of introspection because I do most things autonomously. Most decisions I make, I don't consult with anyone. If that makes sense?
Yes.
I lead a purpose-driven life. On my social media, #purpose-driven, #activated, #spiritualized.
Yes.
Yes, and that's making me resilient. I'm very resilient. Yeah.
Yes, and that those things are the bedrock of resiliency, and that's the point that I want to make. Folks you guys who have been through mental health challenges or substance use disorder challenges, you have resilience. You've demonstrated it. You've been challenged. You've struggled. You've recovered from depression. You've recovered from, and even if you're in the process of, your resilience, those skills that you have, the ability to be focused and committed and resilient, all those things that you've applied to getting well, you can now apply to COVID. And folks who are just experiencing this as a result of COVID, There is no shame ever in accessing help and support. Telehealth is a really good option. And again, I go back to it's kind of safe. Nobody's going to see you walk in. If you're struggling with shame, and not that there's any reason to, but some people do. Who's going to see me at my local counseling office if I go there? Right now, nobody will see you.
Yes.
Engage in a telehealth sense, and you can talk to somebody and you can talk through some things, and you can do that in a way that might be a little more comfortable. Take advantage of that.
So really tell me, let's go over again who should turn out tomorrow to this Facebook Live Winter Wellness Seminar. Tell me, Joy, who do you want to say?
So I would say that people who are in recovery, because we want to celebrate and reaffirm what we have. People who are in recovery from substance use disorder and mental health challenges.
Mm-hmm.
But what I want to do is I also want to invite the general public, because these don't just apply to us. These don't just, we don't get the, corner on empowerment and, being healthy and all that stuff. This is for anybody who wants to kind of maybe look at some solution-focused resources, actions, and behaviors that might help us lift each other up. The other thing is, I kind of joke, but sometimes not being with our family for the holiday is the healthiest thing we can do. So, and that's like the other piece I want to talk about really quick, because you get me started. Sorry, I'm sorry, Arthur, but I got a whole toolbox here that,
Yes.
Looking at what have you gained from the situation? And I know that
What have you gained?
That's really challenging. But I'll tell you, I've enjoyed slowing down a little bit. It's something that I tend not to do, and so
okay,
being able to dial it back and spend a little more time just being. And we have a hard time with that.
Just being.
Yeah, imagine that. You know what I mean? Just being present. It sounds really funny, but spending time with my dog. I love my dog. But those and valuing what I do have, and understanding that even though things have shifted.
You're hitting it on the head. I'm receiving this. That's why I lead a purpose-driven life. Exactly. That's the holiday season. My family is all in Washington, D.C. I don't have family in Florida. Okay. They're all 14 hours away, and I am okay.
Right. Well, now you made me think of another one. I'm sorry.
See?
I think we're just basically going to do this right here. No, I'm only joking. We're not. So giving back.
Okay.
One thing that has helped kind of lift me up during this season is being able to participate in getting some toys and gifts and clothing for women and children who are in recovery houses at this time. So moms with kids, we do have in the Pennsylvania area a few recovery houses that have moms and kids. And they wouldn't have normally a traditional Christmas. The moms are just getting back on their feet. They don't have, they might not even, actually, some of them have arrived with just the clothes on.
Wow, Joy, you're like my soul sister. Over the weekend, let me tell you what I did over the weekend. I cleared out half of my wardrobe. Oh. I gave it to a local nonprofit that gives clothing to men who are preparing for job interviews. Yes, I did. And so I remember just this morning, I was looking at my closet and I was like, all the suits that were on this side and the shoes and the bow ties and the necktie, they're gone. And I wanted to do that because we're going into a new season. I said, I got to rotate the wardrobe. This is so crazy. And I think COVID gave me the time to actually focus and say, all right, let me clean house, so to speak. Yeah. Okay. So again, tomorrow, 7:30. 7:30. Yes. Winter wellness, the gifts. Yeah.
Yep. 7:30.
All right. Joy. You're a pleasure, Joy. Thank you for bringing our viewers holiday spirit. So I'm telling you, thank you so much.
Thank you.
And I wish you the best during COVID. Audience, viewers, please tune in tomorrow at 7:30. Retreat Behavioral Health Facebook, their Facebook Live, Winter Wellness. Bring those questions and comments. That's the gift that I think you'll be giving to these folks. All the questions and comments. Joi, thank you so much. Be blessed for the remainder of 2020.
Thank you. You too.
Bye-bye.